Even though I'm classed as a junior doctor, I am one of the senior members of the team in paediatric A&E. So I'll be one of the senior doctors. I'll have a team of juniors around me, and I'll also have a consultant who is my senior. So I'm what's classed as a middle grade. Obviously, I will see patients myself, so I could see anything from a baby that's 2 days old that's come in because they're not feeding well, right through to the school child that's got meningitis and is extremely sick, and we manage them in an area like resus, to the teenager who's fallen off their skateboard and broken their arm, right through to the older young person who has mental health issues. It's a tough job. It's a really tough job. You have a lot of responsibility. A lot of people are counting on you. Sometimes the decisions you make literally are life and death decisions, especially if you are in an area where you've got an extremely sick patient and you are the person leading that scenario and you are the senior opinion there who's making all of those decisions. That's a really heavy burden to bear. Problem is, when you keep stretching that workforce, when you keep spreading it thinner and thinner and thinner and trying to squeeze more out of it, there comes a breaking point. And I'm worried that if the wrong contract is introduced, then we'll hit that breaking point and the system will fall apart. That's why we're concerned. And the system will fall apart, and guess who suffers? It's the patients that suffer. A lot of women doctors may decide to have families. A lot of men doctors decide to have families as well, but generally speaking, it's the women doctors who often go part-time in order to be able to accommodate that or take time out to do that. And that's a normal part of life. The problem is that if you then make it harder for them to do that, or if they feel like they're being penalised to do that, which could potentially happen if the contract in its current state goes through, then you're going to put people off. You're going to put people off careers where, one, they might have to do a lot of on-calls anyway, like paediatrics, and therefore you're more likely to work out of your social or your basic hours, and therefore if you do more time in your unsocial hours and that is cut, you're going to get a pay cut from that point of view anyway. So paediatrics, A&E, intensive care, all of those high intensity, out-of-hours specialities, anaesthetics become unpopular automatically. Couple that with saying, well, actually, we're going to penalise you potentially if you want to have children or take time out to do research, which a lot of paediatricians do, or take time out and have another job, which, for instance, someone like me does. And I think those things make people better doctors. Do that, and you're going to make those specialities even more unattractive. We already have a recruitment crisis in several specialities. I work in 2 of them. Paediatrics is one and A&E is the other. We're hemorrhaging people. And why is that? Because the job is becoming harder and harder to do. It is affecting people negatively more and more because of that, because of the situation and the circumstances that we're in. And there are better options out there. And I think we should be the best option. We work in the best healthcare system in the world. We should be the best option. People from other countries look at our healthcare service and they envy us. But what they don't envy is the working conditions. They envy what it produces, and that's purely because of how hard the workforce works. But they don't envy the working conditions, and I think that's really unfortunate. We want what's fair, we want what's best, and we want what's safe. Just going in with those 3 notions, there shouldn't be an issue. Unfortunately, I don't think everybody feels like that. And because of that, things that are being suggested could potentially mean that doctors work longer hours, or doctors take a pay cut when they already had a pay cut over the years, when things are already quite tight. Doctors being penalised for doing things that could make them better doctors. Taking away safeguards that are in place to prevent them being worked excessively. That sort of thing isn't good. It's not going to be safe, and it's not going to be good for anybody. And that is what's being proposed, despite reassurances coming from various people. And we all know what reassurances can mean, because you can make reassurances and you can make claims, but it's whether it comes out in the wash as to, and we've had reassurances and claims in the past that haven't come out. And that's why we are so scared that actually if we just go through with this as it is, it's going to be to the detriment of so many people.